So every year what we try and do is have a practical showcase where we have speakers who can talk from their own very first-hand experience of how measurement made a big difference to them with the C-suite, with other audiences. So let me introduce you, first of all, to Anil Ranchod, Deputy Director of Public Relations and Communications, the Stroke Association. Please welcome him. And I also welcome Eileen Shield, Director of Communications, Cleveland Clinic. Now, in a moment, you'll hear how both these organizations, varying in size, of course, but had the same problem. They were both facing severe budget cuts. This clip highlights why PR measurement is such a focus for professionals working in non-profits.
We were planning to bring you this next story even before we got word of the sudden death of Gary Shandling from an apparent heart attack at just 66 years old. There's a new study from doctors at the Cleveland Clinic reporting that victims of the deadliest form of heart attacks are actually getting younger. The average age now just 60. NBC's Ann Thompson explains the alarming trend.
Every 43 seconds, someone in America has a heart attack, and increasingly, that person is younger. A new study from the Cleveland Clinic says the average age for the deadliest type of heart attack has dropped from 64 to 60, because alarmingly, well-known risk factors are on the rise, including smoking, high blood pressure, obesity, and diabetes. Increases, study author Dr. Samir Kapadia says, are fueled by the mistaken belief that pills can solve everything.
Eileen, would you pick up the story for us, please? And what we'll do, Eileen will hand over to Anil, and then we'll take questions after both have presented.
Yeah, thank you. Thank you, Barry. It's great to be here. You know, that story to me is a great educational piece for the community, and really there's value to that, but we really need to know and understand what is that value. I work for the Cleveland Clinic, which is one of the largest academic medical centers in the United States, and our mission is to do medical education, research, and clinical care. We recently acquired healthcare systems to the south of us, putting us now at about 50,000 employees. And we're increasingly growing with affiliations, integrated networks, and even internationally. I'm very excited to say that we just recently acquired a building in London for potentially a hospital. Those numbers are important because we've really built our internal communication capabilities to be able to support that big infrastructure. We have 40 full-time Cleveland Clinic communications professionals that do internal and external communications, mostly PR, media, and social media. Plus, about 5 years ago, we brought on Ketchum Public Relations, and a couple of years after that, Gorkana. So we've really been focused on measurement now for about 5 years. In addition, we get 600 media calls a week somewhere to our office, which amounts to about 200 stories a day somewhere in the world. So we do really focus a lot on public relations to educate the public about what we're all about. I'm going to spend an extra minute on this slide because this is my drama slide. Healthcare costs in the United States are among the very highest, 18% of the GDP. About 6 years ago, President Obama started the Affordable Care Act, and that passed into law and really changed our world. Instead of getting paid by volume, we're getting paid by value, and still trying to figure out really what does that mean and how does that work. Then we hired a consulting firm for a lot of money that told us that Cleveland Clinic, in order to prepare and adjust to the Affordable Care Act and other factors, healthcare costs are rising, patients have less insurance, have to pay more out of pocket. We really had to find a way, along with all of the hospitals across the United States, how to make care more affordable for patients. So the consultants came in and decided that they needed to cut huge amounts of money out of administration, and they came up with a terminology called cost repositioning, which was a very scary term in our organization. And if you think about it, my team does external communications, so we had to figure out how we were going to talk publicly about taking $360 million a year out of our bottom line. At the same time, internal communications had to really focus on how do we communicate to our employees and reassure them that they're not going to be massive layoffs, which we really didn't know at that point. At the same time, I'm looking at my own team saying, okay, I'm going to have to cut from this group of people, and how are we going to get the work done? So the proposal I cut and the proposal I had to make didn't even include me in the org chart. So going forward, we had a much skinnier organization in communications. The budget was cut. We would have to lose a lot of our resources. And I had to figure out how I was going to do this, and I wasn't allowed to talk to anybody on my team about it. So what it meant to us is they were telling me to come up with a 70% reduction in my staff. So going from 40 people to 12, no resources. And I talked about not what we would be able to do, it's really what we couldn't do and how the team would react, and that we would end up losing a lot of good people. There was a lot of fear, and we weren't seen as a department that generated revenue. We were seen as a cost, nice to have and costly. However, the story is interesting because if you look at corporate communications at the top there, we were only 2% of the entire divisional budget. Barry put the slide in, I like this one. Hold on a minute. But we were 60% of the impact. So when we look at our owned, earned, and paid assets, we were the least costly with the greatest impact. And so, really, I said, okay, we have to really figure out how to demonstrate our value so we don't get these severe cuts. And we also know that Cleveland Clinic's national source, or the greatest source of national awareness is news coverage. So still, we just didn't have all of the metrics to really still demonstrate how we were going to do that. So I'm going to give you just one example of many things that we do. Colon Cancer Awareness Month, it was a big deal to our physician who runs our Whitman Urological and Kidney Institute. And he really wanted to drive awareness of colon cancer among men and try to drive patient volume. And so we sat down with him and really tried to figure out what are his goals and patient volume goals for this campaign that we were putting together. So we used, of course, the principles, the Barcelona principles. We wanted to get the right partners together to kind of do the strategy and really kind of develop the plan, focus on the chairman's business objectives, look at quantity, quality, and then really obviously leverage all of our assets in paid, owned, and earned. You don't have to really look at this carefully, but we developed a campaign called March 4th, and the PR is really hard to have a call to action sometimes, especially because we're not placing an ad saying call this 1-800 number. So we developed an online risk assessment tool, and we promoted it through the media and social media, and we asked people to download this tool, take their risk assessment, and then we wanted to really see what happened. And it took almost a year later to really look at the data, but this is aligning the patient leads that came in based on the media coverage, and then we were able to go back and track the patient revenue based on that. So we demonstrated our case by using analytics, showing the value, and also the leadership, really making sure that we shared it with them, the results, that it actually translated into something. And we ended up not getting the cuts we thought we were going to get. Reputation research, we looked at target audiences, who were, what do they read? We had our narrative down, and we really kind of were consistent in what we did and analyzing it. And we did work a lot with our marketing counterparts. We didn't want to work in a silo anymore. And this was the result just on that one campaign in 1 month. It didn't cost us anything. So it amounted to about $85,000. I think it was a little higher than that. But actual leads that were attributed to PR were significant that our marketing counterparts haven't always shared with us. So we not only maintained, but we grew our budget in 2016. We demonstrated that PR actually brings in new patients, drives national awareness, increased our credibility and our importance among the leadership, gave us more power at the table, and then we understood too ourselves as a team what worked better than other things. And I would just say the takeaway is have a vision, really, stay connected to your leadership and what are our goals, apply the Barcelona principles, because it is very different than what PR professionals have done in the past. Take it slow. We've been doing this for 5 years now, so be patient with us because it definitely evolves over time. Get buy-in from our executives, because if I wasn't able to demonstrate to this, I would have had the 70% cut, and we ended up being able to fill all of our positions and increase our budget. So integrating with marketing was another key piece of that. So thank you.
I thought I'd start by setting a bit of context. What is a stroke? A stroke is a brain attack. It happens when blood supply is cut off to the brain and brain cells begin to die because they starve for oxygen. There are around 152,000 strokes every year in the UK. That's one every 3.5 minutes. Of those, 600 happen in children and babies. And stroke kills twice as many women than breast cancer. It kills more men than prostate cancer and testicular cancer combined, making it the UK's 4th biggest killer. Despite this, stroke still remains largely forgotten or ignored. And why is this, I hear you ask? Well, there's a lot of myths around stroke. It only happens to older people. You can't recover from a stroke. It'll never happen to me. I'm fit and healthy. The truth of the matter is, stroke is closer than you think. But amongst all this negativity, there is some good news. There's 1.2 million people living with what we refer to as stroke survivors. They're living with the effects of this condition. Over the last 20 years, the number of deaths is halved of stroke, and people are making better recoveries thanks to cutting-edge treatments. It's the Stroke Association that has been at the heart of these developments. We funded the initial research into FAST. Show of hands, how many people know FAST? Not enough. I want 90% of this room to know about FAST. FAST is face, arms, speech, time to call an ambulance. Those are the signs of a stroke. If your face is drooping, can you raise both arms? Is the speech slurred? Time to call an ambulance. Not time to make a cup of tea, not time to call and say, I checked with my GP, call an ambulance. Time lost is brain lost. When I joined the Stroke Association 6 years ago, there was a lot of work going on around the country. Fantastic work, but in isolated pockets. And it wasn't having really an impact on the population. So I suggested and proposed that we have a National Stroke Awareness Month. The directors in our management team agreed on one condition. I wasn't allowed to have any money. So I ran this for 2 years without a budget. I know I'm not Jesus, how did I do it? Well, I convinced, always coerced colleagues in other teams. I used bribery, cake, biscuits, whatever I could get my hands on. Emotional blackmail, it's for the stroke survivors. And of course, flattery, your team is the best. You get the picture. But I managed to raise £20,000. It worked. Eventually, we launched our first month in 2001, and in 2013, I got £18,000 from my directors. Yay! Yeah, let's not break the bank, people. But I made up for the shortfall, cap in hand, using the same tactics. If it works, don't fix it. For 2016, using feedback that we had from our supporters, we come up with a theme in 2015 called Make Purple for Stroke. The theme was so well received, people asked us to please rename the month, because it was called Action and Stroke Month. Very charity, and I despised it, but it was chosen by our directors. So when our supporters said, go for Make Purple for Stroke, I was, yes, we're taking it. Why? In case you don't know what Ronseal is, it says what it doesn't return. People knew exactly what they were being asked to do. So what's the purpose of the month? Well, it's to raise awareness of stroke, grow the stroke community, and bring more people to the Stroke Association. How do we do this? We launched the first half of the month with a social media campaign, what I like to refer to as the fun element of our month, where we encourage people to make purple for stroke. Wear purple, bake purple, actually do anything with purple as long as you get stroke mentioned. In the second half, we launched a policy and or behavior change campaign, which over the years has enjoyed unprecedented levels of media attention. And that's thanks to detailed and informed planning. So, all ages, all abilities took part in Stroke Month. We launched our first ever Step Out for Stroke, a sponsored walk series. What was amazing about this is we had thousands of people coming to take their first steps after their stroke. It gave them something to look forward to. And it really provided that focus that they're not alone. Everybody got involved. We had iconic buildings and structures going purple, and even my waist goes to pot over the month. My favorite bit is all the cakes, and even I got involved. Yes, that is me in a Teletubby outfit. But blame my social media team because they said it's going to get retweets. Unfortunately, it did. Not that I was very happy about it. Sorry? Yeah, I think that was one of my directors ran away with it because it had money in it. But in 2014, we faced a fresh set of challenges. We did an assessment of the external and internal environment. There was a need for us to be more efficient in our marketing. We were speaking in a language that wasn't really resonating with our audiences. Many of you in this room will know there was lots of negative publicity which carried on into 2015 and even into 2016 about charity fundraising practices which negatively impacted on our income. Internally, just to add insult to injury, our directors decided we are going to have a restructure of marketing and external affairs. How do you manage a crisis when you're having a crisis internally? Quick and fast learning. Shortfalls in our fundraising targets meant that there was 5% cuts across the board. 5% doesn't sound like much, but for a £37 million charity, our budgets are tiny. Taking 5% is even less. Coupled with the fact that we were struggling to demonstrate impact and effectiveness of our comms collateral. So, what did I do? I got my team at Gokana who do our evaluations to come in. I'm sure they'll add testimony that I'm one of their nightmare customers because I have so little budget, I make them work for it. We have to show, there's no point in using ABEs, we have to show the Barcelona principles, talk about how the impact that we were having. So we set joint objectives with joint KPIs and made sure that we were working together at planning stage. This led to much better outcomes. We saw a big increase in fundraising income, 10% awareness of a rise in mini-stroke, 12% awareness rise of Stroke Association, 26% rise in income. So why do we do it? We do it basically for this reason. This was a comment sent in by a lady who had read our campaign in a Sunday newspaper, and it really touched us. We're not just about the numbers. This is what we're coming to do. Our work saves lives. So in conclusion, I'd like to leave you with 3 things. Integration is key. Planning and identifying measures of success work together. You can't have one without the other. Success is all about impact. So, and finally, the big question is Amex supporting Make Purple for Stroke, or is it just a lucky coincidence? I don't know, but why don't you join us next year? Our hashtag is Make Purple for Stroke, follows at the Stroker Sock, or follow me at Arenshot. Thank you.
Thank you. Before I ask you a direct question of our presenters, has anyone in the room had that kind of budget scenario that they've had to really fight for their budget? Anyone? Anywhere? Okay. Anyone want to talk about it? Very briefly? No? Okay. Fair enough.
I tried my butt over it.
Okay. Right. Let's ask for a direct question of our 2 presenters based on their learnings, what they did. Where's my first question coming from? Okay. Just wait for the microphone, please. I'm looking for a second question to line up. Okay.
Hi, Jesper from Quantum Public Relations in Denmark. It's for the Cleveland Clinic. I was confused. How did you attribute the number of patients coming into the clinic to the PR work that you did? the way you attributed it, sort of.
Okay, yeah, thank you. I probably should have clarified that a little bit better. So what we actually did internally, we're working with our marketing counterparts to build a database warehouse internally so we can correlate in real time, you know, if advertising ran or PR based on call volume, and then we can track appointments as well. And then what we did a year later is we went back and looked at that data and found out that of those patient appointments, the 396 number were attributed to downloads from the risk assessment tool, which were strictly related to PR and not advertising or anything else. So we had all the smart people in the room like you looking at it to help us out. Thank you.
Question from Elaine Phillips. Thank you.
Thank you. Another question for you, Eileen. I was wondering how you came to the 60% impact rate versus the 2% cost.
That was mainly looking at the impressions that our marketing folks looked at paid, owned, and earned, and compared strictly looking at impressions. And right now, that's how we sort of look at the marketing activity, paid advertising impressions versus PR. And then we look at a lot of other things like share of voice and you know, the overall budget of each area, things like that.
Let's have a question for Anil now, otherwise he's going to feel left out.
No.
First of all, I know why we have this sort of colour around also.
Exactly.
Question regarding volunteers. Were you using volunteers for your efforts, especially in social media?
We have a network of about 20,000 volunteers around the UK. We've got what we call stroke ambassadors, who are also volunteers, but we've got one in every region of the United Kingdom, so including the countries Scotland, Wales and Northern Ireland. They've got regions within there, and we've got stroke ambassadors in there. Yes, we do use volunteers there. It's very hard because you don't want to be telling them what to say, but we try and give them the messages that we're trying to communicate so that they do it in their own voice. What we found in the past is, here's a tweet we've done, go home and create your own tweets around it. And automatically they just cut and paste the tweet. And that's not really what we wanted to do. We wanted each country to personalize, each region to personalize it. So it was counterproductive for us to give them stuff. So we briefed them, this is what we want to do. We want you guys to start talking, and rather than providing them with stuff, we work closely with them to get an understanding of what we're trying to achieve.
So any further questions? I've got one of my own to Eileen, which is, okay, so your senior management didn't value what you were doing until you proved the value of it. Has that all changed for good now? Have you kind of moved up, moved on?
Yeah, I think it's a big thing about education, that when the consulting firm came up with this projection of how much money we needed to take out of our healthcare system, they formed a committee. We're a physician-led organization, so we had a group of 30 doctors that I had to present to and say this is how it would be hurt. So I think there was a big educational piece to it too, and they definitely now understand it a lot better.
Yeah. Anil, what's the big single learning from you?
For me, it's already been said before, but it's all about relationships. If you can't have integration if you don't have relationships, you can't have media success. I run my team on the basis that the coverage we've earned and generated is because of those relationships. When they pick up the phone to journalists, they're not explaining that they're calling from the Stroke Association. These are people that they've been talking to regularly. It's not a hard sell. I've got a story for you. Do you like it? Just I'm moving on if you don't. And they have that kind of relationships. Internally, my directors understand what we're trying to achieve. So relationships is key to success, and impact is all about success.
Okay. So I've got room for one more question, otherwise we're going to go for an earlier break. Yes, there is a question. Gentleman in the blue jacket.
Hello, this question is for Anil. You mentioned that your overall objective was to increase awareness of the stroke symptoms. And as this is a conference about metrics, what metrics did you use?
We used a variety of things. So basically, we used Gokana to do some awareness and pre and post campaign. We did it on the cheap. There was only we tested 500 people, but it was enough to kind of ensure that we had seen a rise in awareness of the symptoms of stroke. What was a mini stroke? Why was it important for people to understand what's a mini stroke? Because it's a warning sign that a stroke is about to come. Our campaign that we launched was called Not Just a Funny Turn. In the UK, Not Just a Funny Turn means it's a colloquial saying for, oh, I'm not feeling very well. And people were dismissing mini strokes as it's just something that's going to pass. Actually, it's a warning sign that a stroke was coming. So what we were able to demonstrate was that more people were recognizing this was a warning sign of a stroke and that they needed to take action. And that comment was all about, from that lady that I showed, was all about that. So we used awareness, we used calls to our helpline, we used visits to our website, and Gokana had access to all of this. So we were able to track where we had spikes in coverage and where we had the spikes in those metrics, corresponding metrics as well as also access to the number of donations that were being made. So we were able to show the importance of our media work to the rest of the organization.
Thank you. Right, both were non-profit stories, but learnings across the board of value to really any organization. Eileen and Anil, thank you very much.
Thank you.
Thank you.